Welcome back. We'll start with a new topic, environmental sanitation. What is environmental sanitation? It is keeping cleanliness around the house, in and around the house. So what are the components of environmental sanitation? There are few. Those are water sanitation, food and milk sanitation, excreta disposal, sewage disposal, refuse disposal, vector and vermin control, housing, air sanitation. We'll see one by one. First one, water sanitation. Water analysis consists of physical, chemical, radiological, biological and bacteriological methods. Okay, by these methods you can analyze the water turbidity or how infected this waters are. Public water supply must be safe, reasonably soft, plentiful and cheap. The people who are getting water, it should be safe. Okay, it should be free from all the dirt and infection. It should be reasonably soft. We cannot drink hard water, so soft water, and it should be plenty and cheap. So in the house, how you can treat the water? Okay, by boiling beyond 2 minutes. Chlorination by adding chlorine powder, that is 1 to 5 ppm we can add. Then iodine treatment, that is 10 drops per gallon of water. Then filtration and aeration. These are the methods we can use in the house. Then food and milk sanitation. Here the golden rule of food sanitation is keep it cold or hot and keep it covered. Whether it is hot or cold, we should keep it covered. Okay, otherwise fleas will come and sit and it will transfer the infection, diseases. Three enemies of food storages are high temperature, high humidity, contamination by strong odors. So even if it is high temperature, the food will spoil. High humidity also food will spoil, and it will be contaminated if we are not keeping it covered. So which are the foodborne diseases? Okay, it's also called as food poisoning or intoxication. Under bacterial, there are three bacteria which will cause the foodborne diseases or food poisoning. Those are Staphylococcus, Streptococcus and Clostridium botulinum. These are the three main bacteria which will cause the food poisoning. And plant or animals which are causing food poisonings are mushroom, mussels, fish and herbs. And in chemical, if the food is rich in DDT, lead, mercury and cadmium, you will get the food poisoning. And what is milk sanitation? It is a boiling of milk, okay, what we call pasteurization. And the first one, sterilization, the application of high temperature for the purpose of destroying all type of microorganisms. That is called sterilization. All the type, whether it is pathogenic or normal, all the type of bacteria or microorganisms will die. That is called sterilization. And pasteurization, the application of heat to milk for the purpose of destroying pathogenic microorganisms with minimum injury to the substance. Pasteurization means you're boiling milk. That is called pasteurization. Here, the milk is boiled or pasteurized so that only pathogenic microorganisms will be destroyed, and there will be no problem to the milk. There will be no any changes in the milk. And there are three types of pasteurization. First one, holding or vat pasteurization. That is 140 to 143 Fahrenheit for 30 minutes of temperature. That is first one, vat pasteurization. And second one is high temperature for short time. That is called HTST. Okay. This will be kept in 160 to 162 Fahrenheit temperature for 15 minutes. And the last one is flash pasteurization. That's 190 degree Fahrenheit for few seconds. Okay. First one is holding or vat pasteurization. Second one is high temperature short time. Third one is flash pasteurization. Those are the three types of pasteurization. Next, moving to refuse disposal. Here, there are a few types of community refuse disposal methods. First one is dumping on land. Second, sanitary landfill. third composting, fourth incineration, and fifth one is reduction and salvage. This topic will be dealt detailedly in the next class, next video. Okay. For the general idea, what is refuse disposal? Okay, refuse disposal methods for household. In the house, you can dispose the refuse by burial method, burning, feeding to animal, composting, grinding, and disposal to sewer. So these are the methods we can use in the refuse disposal. How we will collect? The refuse collection. Frequent collection of refuse, especially garbage, is necessary for good sanitation. A longer interval between collection creates problem of storage and foul odor for the homeowner, so that there will be a start the growth of vectors and fleas. This will transfer the communicable diseases sometimes. It is necessary to cover the refuse in the vehicle during transportation to final disposal sites to prevent fleas, minimize odors, or remove traveling eyesores. Okay. Fourth one, it is important to have adequate and properly maintained collection carts, trucks, and other vehicles to eliminate collection delays and complaints from residents. It is whenever the refuse is collected outside the house, the government should take care that all the refuse is transported in time, and which will reduce the nuisance. Okay? And during the transportation also, it should be covered to decrease the further problems. The route to the final disposal should be as direct as possible from the point of origin. It should preferably not pass by street. It is preferable to have collection done at night. So, when you transfer the refuse, okay, to the disposal site, it should be straight road, not the bypass road, so that all the refuse will be dumped on the way. Okay? And it is preferable to have collection done at night rather than in the morning. How you will control the vermins? That's also called rodents and insects. There are a few types: physical or mechanical, chemical, biological, environmental, and educational. In the housing sanitation, the characteristic of an acceptable house is there should be adequate space, what we already discussed in the housing, at least 50 square feet per person per bedroom, adequate lighting should be there, and adequate water supply should be there for the person. And characteristic of an acceptable house should have noise less than 30 decibels. It should not be more than 30 decibels. And there should be adequate heat and ventilation, equipped with sanitary toilet, food storage, and proper refuse disposal. In the emergency situation, what are the sanitation requirements? In the water, minimum demand for person per day is 2 liters for drinking, 10 liters for food preparation and cooking, 15 liters for bathing, 15 liters for laundry, and 10 liters for sanitation and hygiene. But in the emergency situation, water level in the hospital and clinics, outpatient 4 liters per patient per day, and inpatient 40 to 60 liters per patient per day. And in the feeding center, it should be 20 to 30 liters person per day. What is quality control? It is to preserve public health. A large amount of reasonably safe water is preferred over a small amount of purified water. Okay. Safe water is transferred than the purified water. Bacteriological, biological, chemical, physical, and radiological quality of water must be deemed safe. All the bacteria, biological, chemically, physically, radiologically, everything, it should be safe for the person. There must be no fecal coliforms per 100 ml at the point of delivery. Okay, when you transfer the water to the people in the village or in the town, it should not have fecal components. Okay, people drink water from a protected or treated source in preference to other readily available water sources. Here, steps are taken to minimize post-delivery contamination. no negative health effect is detected. Okay, there should be care should be taken so that there will be no contamination during the delivery. Next, decontamination and disinfection of water. Water purifier, that is 2 tablets per person per day. HTH, that is high test of hypochlorite. Stock solution 1 liter per 20 families and per 5 days. Okay. If the water is stocked, then you can add 1 liter of HTH. Next, shock disinfection, 50 to 100 ppm of 70% available chlorine. That is called shock disinfection. You are adding the chlorine, okay, 50 to 100 ppm. And other requirements here: drinking water container, 1 container of 10 liters per family can be delivered. Communal water storage tank, 10 liters per person per day. Volume of tank must be good for 2 days. Shallow well, for toilet flushing and cleaning only can be used. That is shallow well. Latrine, 1 per family. Minimum 1 seat per 20%, 50 meters away from the house. The latrine should be 50 meters away from the house. And the waste disposal, 1 communal pit should be there per 500 person. And the soap, 250 gram per person, okay, per month. The shelter, individual, 4 square meter per person. In the collective, totally 30 square meter per person, including shelter, sanitation services, community activities, and warehousing access, etc. So that's all about the environmental sanitation. We see in the next chapter. Thank you.